Good morning, Mrs. Williams. You have been prescribed ciprofloxacin to treat the pneumonia you contracted while staying at the hospital. In case you did not know, pneumonia is an infection of one or both of the lungs caused by a germ. This means that the germs make it hard for the lungs to function properly. As a result, the alveoli, or air sacs, will fill up with fluid or pus, making it hard to breathe. This may also lead to other health complications. Most often, pneumonia is caused by a virus, bacteria, or fungus that is in the air we breathe. Usually, we can defend ourselves from these sorts of germs, but when we are sick, these germs overwhelm the immune system and the lungs become infected.
Symptoms of pneumonia include tiredness, chills, rapidness of breath, headache, and fever. Coughing can produce thick, creamy, or bloody secretions, and patients may appear fatigued or in pain as a result. There may be a loss of appetite, nausea, and vomiting. The patient may have a headache, chest pain, or abnormal respiratory patterns. To correctly diagnose pneumonia, lung infection tests are taken, including the conventional chest radiograph. A healthcare provider can auscultate for lung sounds like rhonchi or cackles, and take mucus samples for culture and sensitivity testing.
The medication you'll be taking is ciprofloxacin, also known as Cipro. This medication is an antibiotic used specifically for bacterial infections. Cipro will prevent the bacterial cells from making copies of themselves and help decrease symptoms of infection and kill the bacteria. In order for this medication to do its job, it is very important that you finish the prescribed amount your doctor has ordered.
You should be taking 500 milligrams, which is one pill, every 12 hours. You can take Cipro with or without food, but you do want to take your antibiotics at around the same time each day to ensure that the level of the drug in your system remains constant. This will help you fight off the infection more efficiently. It is worth noting that calcium has been shown to reduce the effectiveness of Cipro, so you should take your medication 2 hours before or 6 hours after consuming calcium-rich foods. There are some drug interactions between ciprofloxacin and some of the other medications that you're prescribed. Cipro has been shown to heighten the effects of Coumadin. If you have a cut that won't stop bleeding or show any signs of internal bleeding, contact your doctor right away. Taking Cipro at the same time as Norco may increase the blood levels of Norco. This may cause side effects such as dizziness, lightheadedness, and impairment in thinking. If any of these symptoms appear or worsen, it is wise to contact your doctor right away. In rare cases, Cipro has been shown to increase the effects of metoprolol. If you notice symptoms such as fainting, swelling, or sudden weight gain, it is wise to contact your doctor for advice.
Side effects that can occur while taking Cipro include confusion, photosensitivity, diarrhea, nausea, abdominal cramping, dizziness/drowsiness, hyperglycemia, and hypoglycemia. The most common side effects that occur while taking Cipro include diarrhea and nausea. Cipro also has some adverse side effects that include elevated intracranial pressure, seizures, suicidal thoughts, hepatotoxicity, C. diff-associated diarrhea, and anaphylaxis. Make sure to really look for these adverse side effects, Mrs. Williams, because you have an increased risk for experiencing them due to your age. There are also certain things that you want to look out for and report to your healthcare provider while taking Cipro. For instance, if your blood sugars get too low, this medication has a side effect that can lower your levels. You are also on insulin, which also works to lower your blood sugar. Therefore, you have an increased risk at having very low blood sugar levels while being on this medication. You also want to report if you feel like you are unable to breathe or that your throat is closing up. If this occurs, please discontinue use of the drug immediately and contact your healthcare provider. You also want to make sure to monitor your bowel functions and report any diarrhea, abdominal cramps, fevers, bloody stools. And lastly, please make sure to notify your healthcare professional of any medications you are taking, both prescribed and over the counter, along with any herbal products, due to the fact that these can interfere with Cipro.